I came here 3 years ago, and they got me off the street within, within a month. Within a month after being here, they had me on medication, and they really helped me.
On site here, we have a drop-in center where clients can come in and meet many other basic needs, such as using a telephone, using a computer, taking a shower, doing their laundry. They can also meet with a case manager and attend individual and group therapy. It's a pretty supportive environment. It's pretty much self-run.
My name is Brian Hindy, and I'm the director of the Assertive Community Outreach Program. The program is now 20 years old, started in 1988. Shortly after the federal government passed what's called the Stewart v. McKinney, which was federal legislation for the homeless. That federal funds came through the state, and with the state match created our program in 1988. And then it was a very small program. We had approximately 6 staff people, 6 caseworkers, huddled into small little administrative offices, and our budget was just slightly more than $200,000 a year. We now have a variety of resources and a budget of more than $1.75 million a year.
In the community, we have shelter crisis services, in which we actually go into homeless shelters during the evening and we attempt to do outreach. We address any kind of needs that they have. If they're struggling in the shelter, struggling to adjust in the shelter, we also meet with their staff there and provide them education on how to manage clients who may be struggling with mental health or substance use issues.
We want to get them off the street as soon as possible. We follow through with basically their Medicaid and SSI because we know that those are the 2 things they most definitely need in order to, even live comfortably when we take them off the streets.
I see it as being unique in that we do specifically look out for the people who have nothing. Most of these people come into the program without any payer source, and we provide care for them within the limitations of this program, and that's the reason we try to get some kinds of funds available so that we can pay the co-pays for their medication, or in the case where we have the low-cost medicines, we can pay that $4 fee for those low-cost medications. But we don't turn anybody away. They come in during the day, they can launder their clothes, they can take a shower, they can play games, they can do job searches on the computer, or they can just sit around and read a book in a comfortable and safe place.
We have several collaborations with other community partners, such as the Salvation Army. We have our 10-bed Safe Haven house, which allows a client to move from street shelters into a longer-term transitional shelter, and they can stay there for up to 6 months. We also have collaboration with Restart, which is New Start Housing, and is about a 17-unit apartment complex where clients can move into permanent housing.
I am Tiffany Green, and I am the program director of Salvation Army Access House as well as the Haven of Hope program. The Salvation Army and ACO, we work in collaboration. It is a partnership between the two of us. They handle mainly the psychiatric and the medical portion, as well as the housing component. And us at the Salvation Army here at Access House, we're mainly focusing on working with residents on life skill living training that they're going to need when they do transition and move out into the community. If we had to do it on our own, it would be very expensive. Having Truman there as a resource is definitely a benefit, so that they're able to access the doctors, as well as them being able to visit the Felix building to get their medications and things like that. So I don't think it would be nearly as easy or as possible for us to do it without Truman.
Life is good, man. Mental illness is doesn't stop you from having a life. Places like this give you hope. You know, there's people that's really in it to help.
It's an awesome program. I have never seen a program set up right along with hospital services. It is different because we are able to go hand in hand and talk with the psychiatrists. Once we get them in the program, we're able to go in and talk with the doctors, the psychiatrists, the therapists, to make sure that they are receiving the care that they need. And I think that's an awesome tool itself, that we are all able to come together and to serve a client.